my name is Jacqueline Coster, and our group project is on role competency, the clinical, professional, and systems leadership.
I'm Terry Pizania.
I'm Heather Ducote.
And I'm Jennifer Price.
And I'm Mary Tank.
Hello, my name is Jennifer Price. I'm a family nurse practitioner student. Today we'll be talking about characteristics and traits of leadership. According to Tracy and Hanson, some attributes of leader include expert communication skills, commitment, the development of their own style, risk-taking and self-confidence, willingness to collaborate, visionary qualities, skills in cultural diversity and awareness. According to Tracy and Hanson, there are 3 defining characteristics of leadership. These include mentoring, innovation, and political activism. First, mentoring involves leaders helping others grow through competent caring. In addition, leaders possess the confidence and the skills to help others. Lastly, mentors empower others. Second, innovation occurs when leaders initiate change. In addition, leaders must identify personal core values for effective changes. Finally, during innovation, leaders demonstrate perseverance, patience, and compassion. Third, political activism involves the nurse practitioner advocating for patient issues and advanced practice. Lastly, the nurse practitioner must advocate and make changes in the political realm.
Hi, my name is Heather Ducote, and I will be talking about research in leadership. Healthcare research is the cornerstone of evidence-based practice, and it is used worldwide. As a discipline, nursing has produced and continues to produce research at the highest level. Although leadership and research by advanced practice nurses needs to continue to increase, and it is the job of us as advanced practice nurses to continue to research and use our research abilities. According to the Journal of Nursing Management, an advanced practitioner is defined as a nurse who practices autonomously, is responsible for decision making at an advanced level, managing multiple patient cases, demonstrates professional and clinical leadership in practice, and advances clinical expertise through research. Advanced practice nurses have the responsibility as leaders to shape healthcare reform, develop their profession at a national and international levels, and lead change in response to patient needs. Leadership is a phenomenon difficult to define. People define it all differently. Unanimously agreed upon clinical leadership definition is difficult to find. Most definitions used are just noted traits and competencies found in leaders, but not every leader. Advanced practice leadership is under-researched and lacks empirical evidence on how clinical and professional leadership is used in practice. Clinical leadership activities include initiating and changing the patient and client care through practice development. They take responsibility for policy and guideline development and implementation of the guideline. They introduce and develop patient care services and change clinical practice through formal education. The advanced practice nurse also takes part in leadership by counsel and coaching the team in clinical practice and act as a positive role for autonomous clinical decision making. Professional leadership activities can include developing policy at a national and international level, engaging in education outside the service of a national and international level, and engaging in professional organizations and committees at a national and international level. Future research in leadership needs advanced practice nurses.
I'm Mary Tank, and I will be discussing examples of leadership in advanced practice registered nursing. In the clinical competency, An example would be an APN noticed that 50% of urine cultures in her office are being reporting out as possible contaminant. Upon investigating, she learns that 50% of the 50%, less than 1% of the contaminated urines are from males. This finding is representative of the clinical's history of the males. However, the large number of females with contaminated urine is not. She has her staff review the last 6 months of urine cultures and notices that in the last 3 months, the number of contaminants significantly increased. She calls for a staff meeting to brainstorm the possible cause of these increasing contaminants. Her supply ordering clerk advises that about 4 months ago, she ordered a cheaper brand of wipes for females to use prior to obtaining urine specimens. The APN requests that the clerk order the previous brand and throw away the cheaper brands. Within 1 month of switching back to the original brand of wipes, the clinic's urine culture contaminants were back to the average and not increased, coming back as possible contaminants. An example of leadership under the systems domain would include the emergency department advanced practice nurse notices that only about 25% of patients registering in the department are considered true emergencies. The wait time for the 25% of true emergencies are increased due to having to navigate through the non-emergency check-ins. The remaining 75% registering reports complaints that can be resolved in outpatient clinics. She develops a plan that separates the 75% into different sitting areas in the emergency department to differentiate those needing prescription refills to those needing assessments and test ran. With the facility's permission, she posts a sign stating that persons with non-emergent complaints will experience longer wait times due to emergency needs will be handled first. A second triage nurse is assigned to monitor the 75% for changes in level of care, should they become true emergencies. The separation of the 25% of the true emergencies from the 75% of non-emergencies decreases the wait time for the true emergencies by 2 hours. In the professional domain of leadership, advanced practice nurses working towards full practice authority by contacting state representatives, educating the public, and becoming members and active in the LANP are examples of professional leadership. Examples of professionalism domain of leadership are nurse practitioners working towards full practice authority by contacting state representatives, educating the public, also by becoming members and active in the LANP. A few advanced practice nurses who are examples are Patsy McClanahan, WHNP, who served on the Louisiana State Board of Nursing, Laura Griffin, FNP DNP, who precepts family nurse practice students, and Lisa Beha, DNP, ACNP, BC, FNP BC, and FAA-NP, who is president of the Louisiana Association of NPs. And also there is Betty Vigner, APRN, MSN, PNP, who is the president of the Louisiana NP Foundation.
Hello, my name is Jacqueline Coster, and I will be discussing leadership in Hamrick's core competencies of advanced practice nurse framework. Core competency defines advanced practice nursing regardless of the area that you practice in, whether it be clinical practice, administration, anywhere that you practice in nursing, there are core competencies. 3 key elements of that are, it is a key element in advanced practice nursing. It develops over time, and advanced practice nurses have clinical, professional, and system expectations. These expectations are different for advanced practice nurses as compared to other areas such as staff nurses and nursing administration. Strategies for implementing the leadership competency, there are 7 key strategies, which are developing a portfolio, promoting collaboration among advanced practice nursing groups, motivating and empowering others, networking, engaging others in planning and implementing change, institutional assessment regarding readiness for change, and fellowship. In developing a portfolio, it's important for new advanced practice nurses to develop leadership skills for their resume and their portfolio to further their career opportunities. Whether you are beginning in some type of leadership role, or whether you want to consider doing that later, if that's something that you don't want to consider at all, you still need to have some leadership skills, because you don't know what kind of roles that you'll be placed in. For example, I never really wanted to be a charge nurse, and so here I am as a charge nurse, and leadership skills are something that I had learned in my bachelor studies, and so that's something that it's a skill that you always need to have and hold on to, so that in case you need to, you can use it for later. Portfolio should also reflect professional and personal goals with a timeline and boundaries for the advanced practice nurse. Promoting collaboration among advanced practice nursing groups. It's been historically difficult for advanced practice nurses, all of them as a whole, to come together and unify for the good of all advanced practice nurses. Each subspecialty, such as CRNAs, nurse practitioners, midwives, they have their own guidelines and rules that they practice by, but it's been increasingly difficult over the years for all of these subspecialties to come together and to unify as one for the greater good of all advanced practice nurses. But there is a good example in our book from Hamrick that is an example of the APN unification, and that is the consensus model work that has been done. Motivating and empowering others. This happens over time, reinforcing autonomy and authority with a sense of responsibility and confidence. So, advanced practice nurses, you want to motivate. You help others in your advanced practice nursing and staff nurses. It doesn't just have to be nurses, lab, respiratory, everybody. Just unify everyone, motivate everyone so that we can do what is best for our patients. Networking, there are two different types. We have formal and informal networking. Formal, it opens relations for new opportunities and to share resources and knowledge to keep competition thriving. So these would be your conferences that you go to, where you network with other hospitals, where you would network with different organizations through nursing. And then you have informal, which is behind the scenes, more brainstorming with people of like minds and opinions. So that would be people within the office that you work in or the region that you work in, so that you can, for a common goal that is a more specific thing that you need for whatever it is that you're trying to achieve. And then the book quotes, make your net work. And so those that you surround yourself with, you need to make sure that they are, everyone's doing what is best for whatever needs to be done. Engaging others in planning and implementing change. We need, as nurses and advanced practice nurses, to constantly be assessing the need for change. Not everything stays the same. Healthcare is constantly changing. And so as it's changing, we need to change our practices to do what's best for our patients. We need to involve everyone in change, other advanced practice nurses, doctors, staff nurses. Everyone needs to be involved in change so that everyone can be on the same page and we do what's best for our patients. And then help colleagues to develop resilience. Our book says that resilience is to be organized but flexible and proactive than reactive. So you don't want to react in a way that is negative or hinders change. We need to be proactive, be positive, take change in stride, and just kind of roll with the punches and let's do what's best to get things done. Institutional assessment regarding readiness for change. There is an example that one of my instructors used in my bachelor's studies, and she said that we are standing on the shoulders of those who have written the guidelines, and that is what is the best practice. So, but advanced practice is always changing. The best practice is always changing. So we want to use evidence practice, collaborate with other advanced practice nurses and staff nurses, and keep in practice what is the best practice. We don't need to get in the habit of doing things just because that's what's always been done. If we use the best practice and use it well and stay on top of research, then we can lead well and do what's best. And then the last is fellowship. That is something that some people struggle with, and that is to know when to step down and to follow. So there might be people that are have been doing things longer. They have more experience. They are more familiar with a specific area of something that needs to be done. We need to know when those people that are better than us, let them take the reins and do what is best for that project. And then we also, as leaders, need to give those that are coming up behind us the opportunity to lead themselves. So we can teach people to lead, and we need to understand that sometimes we need those younger nurses, the less experienced nurses, give them the reins and give them the chance to lead. And we can step back and we can watch and guide them to be better and do better at whatever it is that they're doing. But we need to know when to step down, and also we need to know when to step up.
Hello, my name is Terry Pizania, and I will be presenting the APN leadership definition. According to Tracy and Hansen, leadership is not optional for APNs. The extent to which an APN chooses to lead in each area of leadership depends on several things: patient needs, personal characteristics and interests, and commitments of the APN, institutional priorities and opportunities, and priority health issues. Contemporary definitions of leadership are divided into two categories: situational and transformational. In transformational leadership, the leader and follower form a sense of unity and wholeness. It results in changes in values, attitudes, and perceptions and behavior of both the leader and the follower. Transformational leadership happens when interaction of people inspire higher levels of morality and motivation between each other. Both the leader and the follower are satisfied. According to Leggett and Balding and Shifton, transformational leadership is the foundation for nursing leadership. These leaders are able to inspire others to change their expectations, perceptions, motivations, and work toward common goals. Situational leadership styles are flexible and based on the environment or situation. The leader and follower are able to adapt to environmental demands while interchanging roles, and this is necessary to meet the complex needs of patients. Domains of APN leadership are clinical leadership, systems leadership, and professional leadership. Clinical leadership focuses on patient and quality of care and requires working with other disciplines. The clinical leader displays self-accountability and is able to persuade and guide patient care at personal, group, departmental, and organizational levels. Systems leadership is leading at the organizational or systems level. The systems leader is able to identify a need and implement strategies to foster a change. Examples are a clinical team leader, a committee chair, or a board member. Professional leadership includes mentorship, empowerment, and organizational participation. The mentorship facilitates the growth of other nurses. Empowerment includes the empowerment of self and others. And organizational participation includes those organizations close to home and internationally at local, regional, or national levels. According to Leggett, Balding, and Shifton, in nursing literature, there's an increasing recognition of leadership roles required of advanced nurse practitioners.